Welcome to Courtney on Health on malcolmpresents.com and other websites, which you have to go hunt and find. Anyway, Malcolm Presents is a new internet streaming platform, which has several other stations, and you'll see Max on some of my other shows. But Courtney, we have yet to find another location. Anyway, Max, introduce our show.
Okay, there are other locations. So hi, Courtney, and hi, Malcolm. Welcome to Courtney on Health, a Zoomcast series. It's also a podcast. It's also on YouTube. So there's two things about how to get through these continual COVID times. We'll have to do a show on it, going to probably be endemic, with tips on nutrition and exercise given by Courtney Gravenese, registered dietitian with a Master of Science degree in nutrition and applied physiology. We're going to talk a bit about that today.
Okay,
for sure. She's an experienced nutritional and health consultant in New York metro area and of course beyond, and will help guide you on a path to wellness and health. So I'm just going to do a quick quote and a quick sentence and get Courtney right in today, because this is special today. I'm looking forward to hearing all this too. Here's a quote. If we could give every individual the right amount of nourishment and exercise, not too little and not too much, we'd have the safest way to health. And that's Hippocrates. That was a long time ago. And so, I just said you're a dietitian and we have nutrition and applied physiology and all these, we have degrees and things. A dietitian is an expert on diet and nutrition, and you have extra, because of the physiology component. So you're like incredible amount of school that you probably had to go through, which you'll tell us about. And so Courtney's going to take us through her journey on becoming a registered dietitian and what path you need to take to become an RD. She'll tell us that RD. I always get little, abbreviations. So, Courtney, where did this journey start?
Gosh, well, I will say it did not start with my undergraduate work. My undergraduate was in communications. I was a speech and journalism major, if you can believe that one.
Sure, I could believe it.
And just shifted, careers after that. Although I will say that speech and communications degree has served me well. I didn't know it at the time. I thought to myself, oh my gosh, I felt like this was such a waste. But given what I do a lot of presentations. I work with groups. I'm constantly doing education sessions. It's really helped me have certainly back then, but you never lose these skills, develop those skills. It helped me be more comfortable and confident speaking to people. And we'll talk about this with regard to, finding the right dietitian for you, really being able to comb through research and data and pull it all down, and being able to, understand it. And most importantly, being able to explain it to somebody who might not have a science degree. And that's most people, right? That's most, people out there. So, so I started doing a different area of work. And I don't know what exactly it was that pivoted me towards nutrition. I was always interested in food and exercise. When I knew I wanted to go back to school for my master's degree, I kept going back and forth. Like, do I want nutrition? Do I want, do I want exercise? And lo and behold, I found this program at Teachers College, Columbia University, that ended up being a combined nutrition and exercise physiology. That's where the applied physiology comes from. It's applied physiology, but think mostly fitness-based, exercise-based. So it was a beautiful combination of both of those things. And I haven't looked back ever since then. So, like many college students, that's a time where a lot of people go through some weird eating, dysregulated eating. We eat a lot of strange stuff. We don't eat healthy stuff. And I'm sure there are some students that do eat well. I think it's changed. But maybe that sent me down my road. Like, I felt like I wasn't eating really well. And then it sort of just catapulted me into, I should really learn more about this. So,
Did you in terms of I'm going back to your youth or growing up with your family, you you might have had in your brain, because I think you're a foodie at heart somehow.
Absolutely. Yeah.
So was that growing up as well? And it kind of just, when you got it, you were in college and then you wanted to go into this area, was that in your brain at all? You just were looking like, I'm going to find something I like. I mean, because there had to be something in there that pushed you, I think.
Definitely. I don't think I had the appreciation of, I consider myself very fortunate that I did grow up in an environment where people did cook all the time and we loved food and mealtime was embraced. And I just assumed everybody had that because that's all I knew. But that's not the case. So I'm grateful for having that opportunity. Although I didn't really see that in college. In college, I went completely off the rails. I really did. I just, I really ate poorly. Although I think it is much more difficult now with social media and the presence of, imaging and it's not just women, it's not just girls, it's with guys too. And, pictures and, things we saw in magazines back then about how to eat. And it was some bizarre eating. I mean, everything like eat, only eat small amounts, take all the fat out of your diet. It was all of this, like I said, dysregulated eating that was very pervasive on college campuses. So I think that always stuck in the back of my head. And it didn't really develop until I was out working. I didn't dislike my job, what I was doing, but it wasn't speaking to me. I knew there was something else that I really wanted to do. And that's where I was like, you know what, I'm reading more. My sisters, you guys know my sister's a dermatologist. So I have to say, I think that had a great influence on me in terms of being out there and being in the health field. And, I didn't want to commit to medical school. So this was enough schooling for me. So.
Yeah, you probably saw your sister and went,
Absolutely.
Courtney, your career reminds me of what I ask people, no matter how old they are. I said, what are you going to be when you grow up? And it seems everything that you have done is layered, from communications to food to physiology. And the thing also, which I thought is when you were talking about, you also relate food to good, warm feelings of family.
Definitely.
So that's one of the reasons you're attracted to, because you think of that, you have this warm feeling of having the family eat together.
Oh, yeah. And I do believe that. And I feel lucky that, I do have that. And I'm not a trained, I'm a foodie, and I'm a good home cook. And I like to experiment. I fail a lot of times too, but I like to experiment. But I'm not by no stretch a trained chef at all. I'm a good home cook, but I think that's most people. So I figure if I can do it and rattle some pans and get some stuff together, then, a lot of people can, too. So, but I think that's important because you need to be able to throw some foods together unless you have the means to be able to do a lot of the meal kits and things like that, which some people do. But again, that's not a lot of people. So I hope that I have this realistic approach to, meeting people where they are, meeting clients where they are, and really working with them on skills. But what can you do? What can you afford? What does your kitchen look like? How many people you feed? And tell me a little bit about it. And then going from there. So it has to be a very practical approach. And I hate to say this because I feel like I'm throwing, dietitians under the bus. But I feel like we can be a little sanctimonious, preachy sometimes, right? Like eat this, not that, the right way versus wrong way. And that's not what food, love, back to your point, Malcolm, that's not what it's all about. So I am going to touch on before we wrap later about sort of red flags and things to look for when you're looking for a practitioner. But in terms of education, like I said, my program was a combined degree, which is fantastic. By 2024, if somebody's out there interested in becoming a registered dietitian, it used to be that you just were required to have a bachelor's degree. Then you had to do coursework and then do an internship. And those internships are really designed to expose a man or a woman who wants to be a dietitian to all the different areas of dietetics that's out there. So there are foods, you have to do a rotation in food service. You have to do a rotation in research. You have to do a rotation in clinical work. So you get your fingers in all those pots so that you can formulate, where is it that I really want to land? But the experience is key. You want that. And then you sit for a state test. And then you get your registration. By 2024, you will be required. I mean, I have my master's, and this requirement was not in place back when I got my registration, but you will be required to get your master's degree before you are allowed to sit for the test. So the rules are changing. They've done something similar with physical therapists. So I'm not sure if you know that, but that's a fully tracked doctoral program at this point, nothing less. So they're really trying to tighten the strings a little bit on. We got to make sure that if you're out there and you're a registered dietitian, we want to make sure the education is there. Every 5 years, we're required to have a certain number of continuing education, so that make sure you're staying on top of your toes with research. Ethics, you're required to have an ethics course to make sure that you are applying your skill base appropriately to your client base or your patient base. So it really is a structured environment to make sure that, to the best of our ability, we're staying on top of our skill and doing what we should be out in the environment.
In terms of the clinical approach to things, then when you take an internship, there's so many different things. There's a friend of mine's a dietitian. She specialized in with oncology patients, yeah, and worked, in that field, because you really have to know how to treat, how to, feed someone who's going under therapy or has, so obviously, that. And also people who, obesity is a problem. So there's ways to do that. So how do you keep track of that through the education things you do? Is that how that works?
Yeah, so you usually are tracked to one area. So it's interesting you mentioned oncology, because right after I got my master's, and actually I was working while I was completing it, I spent many, many years at Memorial Sloan Kettering, and that's where I did I was doing clinical work and I was doing research. So I was a research dietitian. So I totally understand, where you're coming from. It's a very, you need to carve out where you want to be. So you can't be a NICU, PICU dietitian and, part-time. I mean, you can be, but it really is a honed skill to be able to, meet the needs of those patients. It's highly specified. So there's a skill set that's there. So you're right. So if you are working on an oncology unit inpatient, those patients have certain needs. If you're on a dialysis unit, those are different. They have retail dietitians now, which is relatively new. So I don't know if you know this, but if you go to a place like, Shop and Stop and, ShopRite, many of these grocery stores now have in-house retail dietitians to help with menu planning. So to help, they'll do education sessions. They'll meet with shoppers to help them, grocery shop. So there's a whole new area of dietetics that people can go into. School-based dietitians. Most people don't know that food-based program, public schools, how we feed our kids in there. A registered dietitian has to be a registered dietitian who's behind the scenes there. And he or she is usually very much behind the scenes. You don't see what he or she is doing, but you need to have an RD. For Medicare reimbursement, for certain reimbursement, you need to have that registration.
But Courtney, I could see that you take this one step further. Like, you're not a cookie cutter. In other words, you don't have your regimen that you, advocate and apply this to every person. It seems like each individual client you do have, you try to tailor make that into their needs, how they would stick to it. Not something that you have to do it this way. You seem to get the personality of the person involved and then do the right thing that they could follow.
I think it has to be that way. I don't see how it could be any other way and be a helpful session with someone. So you guys know I do individual, I do group sessions, I'll do like contractual work with organizations to help. So even if I'm working with an organization and not one individual, you have to find out what the needs are first and then work forward from there. And most importantly, and I think, and this is on my sort of red flag type of situation, you need to be able to remove your personal bias from that situation. And what I mean by that is, it does not matter how I eat. I eat well. And I think it would be odd for a dietitian not to eat well, but that's not necessarily always the case. But what's important is that you don't bring your personal bias into an individual's session. Okay, and what I mean by that is it's important that you use the research that's out there, that's best available to us, and apply that with that individual group or that person. So if a dietitian you're meeting with says to you, well, you've got to go vegan. You absolutely have to do that. And they're kind of pushing you in that direction. A little flag should go up, or something should go up. It's like, that's not necessarily the case. On the flip side, if you've got somebody saying, don't go vegan, if you go vegan, you got to eat meat. You got to eat meat because you're going to become emaciated and you're going to be nutrient deficient. Same thing. So you see, it's the other side. So it's like the extremes that sometimes exist out there. And I will say this is less so in registered dietitians and more so in individuals who call themselves nutritionists, but don't necessarily have the education and the background to back that up.
Well, what's the difference? How would I know as a layperson? I see Joe Smith, nutritionist. Well, I'm going to go to him. Someone said he's great. And then I see, someone with an RD, which you need education. And I mean, you tell me, what's the difference?
Yeah, sure. So all registered dietitians are considered nutritionists, which is now why you will see RDN frequently. So if anybody sees so registered dietitian, nutritionist. So RDs are nutritionists. All nutritionists aren't RDs. Now, that's not to say that every nutritionist out there is, a crackpot, right? That's not the case. You can be a clinical nutritionist with a really good degree, master's degree from a very, an excellent program in the United States, and just have not sat for your RD. So as an individual, you've got to look at the devil's in the details. You have to find out the education, the experience that this person has, and really look at that education if they are not an RD. So where did they go to school? What's their specialty in? And what I mean, it doesn't necessarily mean they had to go to Harvard. That's not what I'm talking about. But what you want is something more than a certificate. Okay. You want something more than, okay, I took an online course and now I'm a, nutrition specialist. Look, ask those questions, find out what they do. One of the reasons why, the RD is important and is a great way to go is they do require you to do this continuing education, as it should be. Most people want to learn and stay on top of their craft, but there's no guideline for that in some of these, if somebody's just calling themselves a nutritionist. So it's important.
Now, Courtney, in addition to being the RD, you also have a physiology background that you also do exercise classes, because to me, it has to be a combination of three things, the diet, the physical activity, and the mental activity. So, but you have the gestalt of the physical activity. So it's, not only do you advise people for nutrition, you advise people how to take care of their body. Could you tell us about that?
Yeah, sure. So like I said, it was a very unique program that coupled the two of those things together. And I agree wholeheartedly. That was sort of my philosophy, and obviously others as well. You can approach this wellness, whatever your goal is, whether to eat better or whether you're trying to reduce a disease like diabetes or obesity or overweight. The two of these have to be taken together. So to me, it's hand in glove. You can't separate, you can't uncouple those two things. They need to be worked on together. And of course, over the years, which is why there's more psychology that's pulled in for these classes, for these degrees. And you're encouraged to take more sociology, psychology classes to really understand the behavior change that's needed. Behavior change is so hard, whether you're trying to undo a bad habit or bring in a good habit. It's really hard to do. So you really have to have that understanding. Whether you're dealing with somebody for exercise or whether you're dealing with them for a nutrition issue. But most clients appreciate the combination of both of those together. Although I will say a lot of clients, if I'm being brought in to work with an individual for a specific need, sometimes it might be just nutrition, like just work with me or my son or my daughter or myself just on nutrition. And then maybe we work on, exercise, if that's an issue for them, and if it's something that they want to work on. I never try and drop it on them.
Well, what about, if you're, you get a general physical every year, you get your eyes checked, you go to a dermatologist, the things that are key for wellness and prevention. I'd say nutrition is way up in there. They should be seeing once a year minimally, to see a dietitian, registered dietitian, to check, to see how you're eating. And especially, I mean, when I had my heart issue, I mean, part of my rehab was I had to speak to a nutritionist, a registered dietitian, and they give you stuff, a whole program. So I would think that should be something that's really important, along with exercise, of course.
Yeah, well, I will say more, certainly multidisciplinary practices are including an RD in their group. So that there is one on site, which I think is a great move in the right direction. Unfortunately, right now, the way insurance works in our country, and it's creeping along, right? In terms of, now this, I'm taking Medicare out of the picture, but for regular insurance, unfortunately, nutrition services, even with a registered dietitian, is typically not covered. So that ends up being sort of the sticky wicket there, is that it's like, listen, I would love to see a dietitian, but my insurance doesn't cover you. So it ends up being a little bit of a conversation like that. So we try and work out things, do you have out of network? Do you have a flex space? So, but the fact that they're trying to pull in more RDs into office space certainly, helps a little bit with that. Community centers now are employing dietitians to have sessions like group wellness, maybe if it's not one-on-one, but they'll do group wellness seminars, which have been shown to be very, helpful. There's a reason why corporate wellness has just exploded over the last decade to 15 years. And that is companies see the return on investment. They see if on the front end, you help the employee base stay healthier, quit smoking, lose some weight if they need to lose weight, change the way they're eating, not to a specific way, but just move the needle a little bit. They see that on the back end in terms of claims. So there's a lot of traction here, moving in the right direction, but it's just a matter of finding the right, finding the right fit. Seeing what's available to you, and then seeking out the right, don't be, if you're seeking out a one-on-one consult with a dietitian, he or she should be able to spend a few minutes on the phone with you to find out what your needs are. What is it that you're trying to get out of this, and see if it's a good fit. And any dietitian who's not willing to spend time with you on the phone for a few minutes to get a gauge, again, that would be another red flag in my opinion. That's not something that they should want to invest that time to be able to get to know you a little bit, to see if they can help you. Because if not, the appropriate thing is to refer you to somebody else who can.
Yeah, but I tell you, now what I find with physicians, if they call you up, they start the register ringing. It's not like they call you up to talk to you. I mean, I've had conversations with doctors and I get a bill, 15 minutes so-and-so or of the bill. But anyway, what I wanted to ask, so it seems like right now where medicine is that once you get the disease, then you can be treated. And I don't know if it's then RD is covered, but in order to prevent the disease, to prevent it, you're not covered.
Yeah, unfortunately, there are no well visits covered. I shouldn't say this. There might be some insurance companies. It really is insurance company by insurance company. Now, again, I'm carving out Medicare because you do get, but again, to your point, Malcolm, diabetes is covered. I will tell you that obesity in many cases, and I hope to see this changed. So for overweight or obesity, historically not covered, but you're right. And then unfortunately we're backpedaling, right? Once you get to, people are, their diabetes is out of control, or their, the blood pressure is out of control. And then you're playing a lot of catch up. So this is why like I said, a lot of these outreach programs that work with groups and individuals to help at least with education programs that, are really, really key, because we didn't touch on this, and I know we're running low on time, but it's getting harder and harder to, if you can go online and find quote unquote credible information from an influencer for free, or you got to pay for a dietitian, most people are going to just go see what's available online. Now, some of that information is credible and research-based and evidence-based, and that's great. A lot of it, however, is not. It's personal bias. They might be trying to sell something. And that is one of the issues that I see right now, that I hear a lot as well. If somebody will see me like, well, Courtney, I saw this, or I'm taking this, and my friend told me this is what I should be taking, or my friend's doing low carb or intermittent or whatever it is. And it may or may be perfect for that individual, but not necessarily for the person with whom I'm working. So it's definitely challenging because that's not going away anytime fast. And in all likelihood, we're vetted, as we should be. Dietitians should be vetted. The internet's not.
After years of dieting and following everything, I realized that each individual is an individual. Like one thing that I might eat that makes me fat, another person can eat that, have a diet of that, and it doesn't make them fat. Some things that make me sick doesn't make
metabolism. The metabolism plays a big part in that, but I don't want to. Go ahead. I'm sorry.
There are definitely some common denominators, but it can't be. It's not a stand. We're not cookie cutter. So you're absolutely right. There has to be some layering of personal, preferences and interests, and that has to be part of the mix.
What about the third layer of the trilogy of wellness, and that's mental wellness? Because that seems to be now a big thing, of course, with our recent shooting. How do you identify someone that needs to, that's flipped, that has to be taken care of? How do you get that mental wellness into the physical plus dietary wellness?
I'm not a psychologist. I'm not a psychiatrist. You guys know that. So all I can do is work within my spheres of what I know. And I hope that if I'm in a situation where I've identified somebody who really might need that support, the best thing I can do as a clinician, and I do, is refer them as best I can to somebody who can help them. I'm not going to overstep my boundaries and do what I'm not licensed or credentialed or educated to do.
But do you do anything with relaxation?
Oh yeah, I'll do that as part of like the behavior change techniques. Something as simple as deep breathing, the relaxation technique, carving out some time throughout the day, progressive muscle relaxation. That's all within things that I can work with, but sometimes it might be beyond that.
So I'm gonna switch out a sec because I know we're getting close to time. I wanted you to talk about, we wanted a spotlight of food. And I know you have a bowl of arugula there somewhere. So
I do. So I thought it would be fun. So for those of you who, listen to the show, but don't necessarily follow me on Instagram, once a month for the last, I'd say, 4 or 5 months, I've been doing a focus on food or focus on fitness post. So I think I thought it'd be fun to bring those up on the show when I do them. So today's happened to be my focus on food, and it was arugula. And it is a wonderful, it's a spring late, actually you can even get it earlier in spring, but now that we're moving towards summertime, it's a wonderful, peppery, spicy, green leafy. Yeah. There are actually cancer fighting compounds in here called sulforaphane that's in here that gives it that punch, that bite to it. So many people love it. I totally get it. If you don't like that, that's okay. But it's wonderful in salads. You could cook it down, but you're going to eliminate that. Fresh is obviously the best way to have it. It's actually very, very low in something called oxalates. And what that means for us is that the calcium that's in this green leafy green is very available to the body. So if you're trying to meet your calcium needs without, using maybe dairy or cheeses, this is one of the greens that you definitely want to include because that calcium that's in there is very available. And it's just, I wish we had smell-o-vision or something.
Smell-o-vision. They used to have that in movies. They had smell-o-vision. You'd scratch.
I love the name arugula. Do you know what the derivation of the word is?
I don't. I know this is typically, I know it's an Italian green, so rocket. I knew it as, it's called roqueta, rocket. Sometimes you'll see it on the menu like that. I think it's a Mediterranean-based food. I think it's grown in sandy, like soil, for want of a better word. So, we're not growing a whole ton of it necessarily, but you can. It's a cool weather crop, so you'll see it early on. And then
you have to say arugula with the hands up. I want some arugula.
You'll see it in the fall again too, but it's a wonderful.
Anyway, guys, on that note, our time is up.
Hail the arugula! I love that.
It's arugula. So Max, send us out.
It's a spicy thing. I love it. All right, it's got that kickback. Anyway, this was great. I'm so glad we were able to talk about some of the things you've done to get to where you are. So you'll keep doing that. And thanks for joining us for Courtney on Health. To get more info, follow Courtney on her Facebook page, which is Courtney on Health, on Instagram at CLG Wellness. Visit her website, CourtneyGravenese.com. For more shows, go to MalcolmPresents.com and theManyShadesOfGreen.com. This is Courtney on Health, smart, sound nutrition, strong, safe fitness, and we'll catch you again next time.
Thanks, guys. Have a great week.
And
You
Courtney,
too. Have
you
a
have
great
a
week.
background. I know that I wish you were closer to me.
Well, she's going to see me. That's what's going to have to happen. There's going to be a consult going soon. So
see you guys next week on MalcolmPresents.com.
all right.
Bye.